I have honor to be moderating today's session. Before we begin, let me quickly walk you through today's agenda. This is the monthly Pakistan Cardiac Society webinar, and Sukkur is the hosting in this month under the supervision of the Professor Dr. Syed Tahir Shah. Our speaker of the today's session is the Dr. Mehfooz Shah, who will be sharing valuable insights into the latest advancement in the cardiology. So we are privileged to have an exceptional panelist of the experts with us today. Let me introduce them. The course director of the today's session is the Professor Dr. Syed Tahir Shah, Vice President of Pakistan Cardiac Society. And Dr. Rajkumar Sarjivani, a professor of the cardiology, and sir is the president of the Pakistan Cardiac Society. Professor Dr. Mansoor Ahmad, who is a consultant cardiologist at Karachi. Professor Dr. Javed Akbar Syal, interventional cardiologist, SICVD Karachi. Professor Dr. Khalda Sumro, consultant cardiologist. Professor Dr. Fawad Farooq, who is the General Secretary of the Pakistan Cardiac Society. Professor Dr. Khal Sultana Habib, she's a professor in the Kidney Center. So having such distinguished expert with us is truly honor for us. To begin, I would like to invite Dr. Mehfooz Shah, consultant cardiologist at SICVD Sukkur, to share insights on chronic coronary syndrome or chronic coronary disease, latest guidelines and updates. So, sir, over to you.
Thanks, Dr. Babar. Assalamu alaikum. I am Dr. Mehfooz Shah. I am working as a consultant cardiologist at SICVD Sukkur. Bismillah ar-Rahman ar-Rahim. Good afternoon, everyone. It's our honor to be esteemed forum among and our such a distinguished our teachers and our experts in cardiology.
ये इस बात को गाउट एक ही पैर में है ना ये गाउट है इसका करते हैं
सर
मंसूर साहब अगर म्यूट कर दें अपने माइक को
सर डॉक्टर मंसूर जी का
क्रिएटिनिन से इसका ताल्लुक है
किडनी का हमने अल्ट्रासाउंड भी लिया
हाँ वो करा लें इसका कोई ताल्लुक नहीं बस ठीक है इसके लिए मैं आपको दवा दे रहा हूँ आप लेंगे
मंसूर साहब काइंडली अनम्यूट योर माइक सो दैट वी मे कंटिन्यू थैंक यू सर
या यू कैन
okay thank you sir
Assalamu alaikum. Am I audible? Assalamu alaikum.
Yes, Mehfooz, go on, please.
Assalamu alaikum. Assalamu alaikum. Good afternoon. It's be honor to be an esteemed forum among such a distinguished. Essentially, thanks the organizer for giving me the opportunity to speak on a topic practice. So let's start our topic. So what's a chronic coronary syndrome? It's basically a dynamic process that involve a formation of atherosclerotic plaque accumulation and functional alteration of coronary circulation, and that can be modified by the lifestyle modification, pharmacological therapy, and revascularization, which result in the disease stabilization and regulation. So chronic coronary syndrome includes chronic stable angina, asymptomatic ischemic patients, prior myocardial infarction, prior coronary revascularization, and
We have lost you. We can see you but can't hear you.
Especially these 6 type of scenarios. Okay, madam, I unmute, but maybe internet problem, madam. Okay. Patient with a suspected coronary disease, stable angina symptom, sign and symptom of dyspnea. Second group of patient with the new onset of heart failure, early dysfunction, and suspected coronary disease. Asymptomatic or symptomatic patient with stabilized symptoms less than 1 year after an ACS or patient with revascularization. Okay, fourth group of patient, asymptomatic and symptomatic patient, more than 1 year after initial diagnosis and revascularization. And fifth group of patient with angina and suspected vasospasmic or microvascular dysfunction. And asymptomatic subjects in whom coronary disease is detected at screening. This is our Diamond and Forrester classification of typical and typical angina. The patient who present in our clinic with retroesternal, subesternal chest pain, with who have a corrected localization to the jaw, left arm, and neck, and that relieved by taking rest or sublingual nitrous. These are three clinical characteristics lead to the typical type of angina. If any patient who have among two symptoms, then we categorize him as a typical angina. Just among them, the patient have if a patient have only one symptom, that called as a atypical angina. So how we will categorize the severity of angina according to Canadian Cardiovascular Society? Grade 1 angina are those patients who experience a symptom on maximum exertion. They don't experience symptom on ordinary their works. And second grade is the angina with moderate exertion. These type of patients experience symptoms on walking on more than one flight of stairs. They often experience symptoms after post meal and cold weather. And third group is grade 3. Grade 3 angina with their patient experience symptoms on a mild exertion, walking on 1 or 2 blocks or less than one flight of stairs. And the fourth group is a patient who experience symptoms at rest. So these are the cardiac and non-cardiac causes of angina. Non-cardiac causes there are lot of causes of non-cardiac causes. We must focus on the cardiac causes: hypertrophic cardiomyopathy, aortic stenosis, dilated cardiomyopathy, tachycardia, aortic stenosis, hypertrophic cardiomyopathy, or high-grade coronary disease, and microvascular circular dysfunction. These are some spectrum of coronary syndrome we often experience in oral clinical patient. We often experience a patient, we diagnose patient, asymptomatic patient. We diagnose him as a coronary syndrome with our any functional testing. Our patient who have angina or angina equivalent with no obstructive coronary disease. Patient who often experience a symptom with stress angina or equivalent with the obstructive coronary disease, are patient who have a previous any cardiac symptom, cardiac problems like MI, and they undergo from the process of PCI and cabbage, are the ischemic LV dysfunction patients. Okay, there are main character symptoms of coronary syndrome. That is a chest pain and dyspnea. So we must distinguish chest pain from other causes of non-cardiac chest pains. Patient who have a typical chest pain, they often experience strangling, constricting, squeezing, pressure-like chest pain. That is most often retroesternal and having radiation to the left arm, neck, jaw, or sometimes back. And that will be relieved by taking rest or sometimes taking some liquid nitrate and remain in a short time, just 5 to 10 minutes, not hours or 3 hours or 4 hours. And they have a trigger factor like exercise, stress, emotional stress, or physical stress, and cold weather, post meal. They are all trigger factors. And typical angina chest pain relieved by taking rest and sublingual nitrate. Same like dyspnea is a second main characteristic symptom of chronic coronary syndrome, and patient often feel difficulty in breathing,